Good day, everyone. I am Lubalethu Dube, and welcome to another episode of In Focus. This is the 10th anniversary of Foresight. The theme this year is Let's Co-Create the Future. And one of the talks that we had was given to us by Shannon.
I'm really passionate about healthcare and about more equitable healthcare outcomes.
Do you mind telling us what Vula is?
Okay, so Vula is an app that helps connect primary healthcare workers to specialists. Instead of using a fax or a landline, they can use Vula, which is an app, to send questions through the app to get advice and referrals from the specialists, and also just arrange getting advice in terms of what kind of treatment they need to do and those kind of things. And the response time is on average 15 minutes. One of the cases that stood out to me with Vula was a patient that had coverage for an ultrasound but didn't have coverage for the surgery that they needed. And so they needed to go into the public sector, but they started in the private sector. Okay. So they had the ultrasound done in the private sector, and then the public sector proceeded for the surgery, but through Vula, they could send the x-ray to the public sector, the ultrasound, to the public sector, and the patient could also carry a copy of that ultrasound. So then when they got to the public sector, they could actually have surgery done much faster.
I love that you spoke about the fact that healthcare is a spectrum. Do you want to just explain what you meant by that?
Yeah, sure. I think many of us think about the private and public sectors as being quite siloed and that they don't interact. But what we actually saw in the data is that there are people that just use the public sector, and then there are people that have medical scheme coverage that only use the private sector. But in the middle, there are a bunch of people who use both sectors. So Vula helps ensure the patients get the right care at the right time in the right place.